I'm Dr. Sahana Ramesh Tambat. I'm founder and managing director of Mangal Homeopathy and Research Center at Indiranagar, Bangalore. I'm having 1.5 decades of experience as a practicing homeopath. I'm specialized in Homeopathic Pediatrics and Dermatology and having seen about 2 lakh cases and treated them with homeopathy. In children, the growth is usually delayed because of multiple factors. Most commonly seen is in terms of chronic illnesses or briefly after acute illnesses, where the absorption state as a whole is reduced, the lack of appetite is there, so they usually don't consume. So these are the phases where usually the child will lack or not be able to catch up with their normal growth curve. So this is where homeopathy is going to be very majorly helpful in children to have that catch up growth period, so that that growth they can hack with homeopathy. So basically the height of the children is not only dependent upon what they eat, and if they are able to catch up with that, there are various reasons starting from the genetics, the family history, the child has had any previous injury, how the child is able to absorb, and is there good exposure to sunlight, how is the activity levels, how is the stress levels which has been present. Stress is not need to be a physical stress, it can be an emotional stress which has also been there. So all these factors contribute to a person's height. So the growth usually occurs in 2 phases. One, they'll have a growth of weight and it will be followed with the growth of height. So usually when there is adequate amount of absorption level, where the whatever required for the bone development, the cartilage development is been absorbed or which is present, and then also there is a physical activity, and then there is a rest and recovery in terms of sleep, this completes in terms of the height growth until puberty, and a bit after that where the height growth occurs. The child usually starts to grow in this phase. After the puberty, there will be fusing of the cartilages to the metaphysis, then the growth usually stops, but even after that there will be a vertebral growth which will be present. So all these 3 stages where the homeopathy can be definitely helpful. So the constitutional treatment is the best treatment, no matter whatever biochemic tissue, biochemic salts, remedies you can add, any kind of drops, any combinations you can add, until unless the causative factor is not identified, the absorption wouldn't take place even after giving best of the medicines. So the very predominantly I have seen in terms of usage of certain intercurrent remedies, that is what is called in homeopathy, have shown marvelous results in terms of stopping this recurrent attacks of illnesses and reducing the relapses and improving the undernutrition. So after having studied about 500 cases during my post-graduation, I have seen that usage of intercurrent remedy has been given a leap of growth in terms of both height and weight for the children, and not only in terms of the body but improvement in terms of their mind and emotional maturity takes place. So it's not that you have to feed your children only organic, expose them to music, sun, and exercise, and be good with them. So the whole the parenting thread taking encompassing all these things also. So the only fundamental thing what homeopathy does is it opens up the child to the change and adaptation, which otherwise the other conventional system will not be able to take it up as a holistic approach.